Most of you guys, I'm assuming, probably want to start a family when you're older. You don't really have to think about it now, obviously. It's kind of a scary thought. But having a kid when you're older and starting a family is one of the most challenging yet rewarding experiences, so I've heard. I don't really know. But in the U.S., starting a family can be extremely difficult. Our country is one of the only countries that doesn't have a maternal leave program federally, and maternal paid leave at that. The ACOG Postpartum Toolkit, published in April 2018 by the U.S. Association of Gynecologists, say that 1 in 4 women go back to work within 10 days of giving birth. And that's not because they want to go back to work. It's because they have to. It's an insane policy. Expanding our maternal leave program here in the United States is not just about doing the right thing either. It's an investment with social and economic returns. So let's define what a U.S. maternal leave is here in the United States. We have the FMLA, which is the Family Medical Leave Act of 1993. It's a law that says that mothers of newborn children are entitled to 12 weeks of annual unpaid leave after giving birth, and this is only at a company of about 50 plus or more employees. Only 6 states have mandatory paid leave programs for new families, like California, New York, and Oregon. So these are pretty liberal states. The U.S. is one of the only countries that doesn't have any federal regulated maternal leave program. Even our closest allies have maternal leave programs. You can see all the countries there. At the top is Estonia with 86 weeks of paid leave. This is a data set of 41 countries from the OECD, which is the Organization of Economic Cooperation and Development. It's a database published in April 2018 and illustrates how popular maternal leave programs are in developed countries. Even our closest allies like Germany, Japan, France, all these countries have maternal leave programs, and they're not just doing it for no reason. There are great benefits from having maternal leave programs. Expansion of this policy affects the health of families. There's drastically reduced infant mortality rate and a 50% reduction in the infant rehospitalization, according to the Health of Mother and Child by Burton and Stoltz from the University of Basel, published in 2006. Paid maternity leave can also help mothers manage their physical and mental health after giving birth in the postpartum phase. Those who go back to work during the postpartum period are just more likely to be stressed and depressed while they're working. According to the article, Does Maternal Leave Affect Maternal Health? Written by Pinka Chatterjee and Sarah Markowitz in 2005. And physically, the length of maternity leads to more breastfeeding, which obviously has a lot more health benefits than using by the bottle, according to Berger, Hill, and Waldfogel in their article Maternal Leave Development in the U.S., published in 2005. Breastfeeding can reduce the risk of breast cancer, and not only for the mother it's helpful, but for the child, they get a lot more nutrients from breastfeeding. If we want women to start their families, we have to give them more autonomy to continue their work, to continue their ability to contribute to the workforce. Expansion of maternal leave is a sign of gender equity in the United States. So there's economic reasons as well why we should expand our maternal leave program federally here in the U.S. If you look at how maternal leave programs affect the economy in states like California, they're actually huge benefits. The Rutgers article, Paid Family Leave Leading to Positive Economic Outcomes, published in January 2012, say that women who take paid leave are 39% less likely to receive public assistance, like food stamps, and 40% likely to take food stamps in general. This allows them to get back on their feet easier. They're clearly not using public assistance programs and being a burden on the system for poorer families who probably need it. Because most of the people who, if they have paid family leave, they're not going on food stamps because they are under the poverty level. They actually have working jobs that pay a substantial amount. They're just middle class folk. So paid maternity leave ultimately saves money for public assistance programs. I urge you to vote for a presidential candidate with a comprehensive plan on how to deal with this issue. I propose that we lengthen the maternity leave time to 18 weeks and set 2/3 of the current wages for maternity leave, and we get paid for this federally. In order to better the lives of women in this country and ensure equity, we need to expand maternal paid leave. Thank you.